All right, Miss Sheila, we can go ahead and get started.
Good evening, everyone. Tonight we're meeting for a community conversation for COVID-19, the COVID-19 initiative, No More COVID. And tonight's guests are Dr. Kennedy and Dr. Moore of Well Lake Pharmacy. Dr. Kennedy, Dr. Moore, can you tell us something about yourself, please?
Sure. My name is DeAndrea Moore. I am a graduate of Xavier University of Louisiana, class of 2009. And so I have been a pharmacist now for, 12 years, 12 years. And I started off working for the big chains, the 3-letter chain to be exact. But just found that I really didn't have time to really spend with my patients and really be involved the way I wanted to be in their medication management. So that's how we ended up starting Well Lake Pharmacy. And a note, Dr. Kennedy and myself, we're cousins as well. So it's a family-owned business, and we both finished pharmacy school and just really were not being fulfilled with what we were doing. So that's how our community pharmacy came to be.
Yes, and hi, nice to meet everyone. My name is Dr. Amanda Kennedy. I graduated from Roseman University in Henderson, Nevada, right outside of Las Vegas. I graduated in 2012. We're celebrating our 10-year reunion this year. So that's exciting. Like DeAndrea said, we did both start in the big box chains. I think we want to be really candid. The biggest discrepancies that we found was in the communities. Our communities, they were underserved. We weren't able to really educate and teach them and really be advocates for them like we wanted to. And it was just nice. And we are so blessed that God allowed us to create a space where we are able to provide that education for our patients now. So that's how the pharmacy came about.
Pharmacy history, Well Lake history.
Yes.
Miss Sheila, did you have anything to add?
No.
Well, my name is Dr. Hayes. I am the project coordinator and principal investigator for the No More COVID project. We have Dr. Stephanie Moore. Dr. Stephanie Elder, who is our project administrator on the call, as well as our board members, Dr. Latricia Harrison. We have Crystal Thibodeau there as well. Miss Yaya, our interpreter, as well as Miss Elda, our project operator. I hope I didn't miss anyone there. Okay, so first we just want to start off with asking you ladies, what is the COVID-19 vaccine and why is it important for our community to take it?
So the COVID-19 vaccine, it is an mRNA vaccine. And before I get started on that, most people, and especially what we find with our patients and in communities of color, so many people are reluctant to take it because they think it's new. They think like it's an experiment. And the thing that most people don't realize is that mRNA has been around for decades. So it was actually discovered in the 1960s. And in the 70s, it was actually, they first were able to insert mRNA into like a viable cell. So, I mean, there's been experimentation for decades. And so I think that's just a big misconception and a barrier to the vaccine is people, especially in our communities, thinking it's an experiment. And of course, we could also get into our mistrust of the government and our medical system, and rightfully so. So that is a big barrier. So, we try to tell our patients this is not new technology. The vaccine is new, but this has been, studied and researched. The messenger RNA, it's basically it allows our bodies to recognize the COVID-19 protein, and in response, our bodies mount a response to the virus. So just like any other vaccine, it allows your body to recognize the virus, mount a response, and therefore prevents you from not completely catching the virus, but from having hopefully any serious illness from that virus.
Dr. Kennedy, did you want to add on that? Oh, she's trying.
I apologize. I'm having some technical difficulties with my computer, so I'm using my phone. I just wanted to piggyback on what DeAndrea was saying, that the importance of the vaccine is really, if you ask people who've lost loved ones, it's life or death, right? The biggest thing is no one knows how COVID-19 is going to specifically affect you as an individual. And I personally took the vaccine because I didn't want to find out how it would affect me. I know healthy people who are still having issues breathing, who still feel tired, and they had COVID a year ago. So the vaccine is so important because it really can make a difference between life or death. And I think we're seeing that COVID wasn't just affecting people who had diabetes or, heart disease. They were affecting perfectly healthy individuals, children, all of those. So the vaccine is important because it can make a difference between life or death. It can make a difference in your quality of life. It's one thing to get the vaccine and you're able to fight COVID versus not having anything in your system. Your body doesn't recognize it, gets overwhelmed, and that response leaves you hospitalized or worse, dead.
I agree. Definitely, I have seen that a lot of people are having neurological effects from COVID-19 up to 6 months post having COVID. They're still having issues with things such as swallowing. That's still being researched and investigated. So that is one of the additional symptoms that I've seen, in addition to many others. Do you all have any personal experiences that you would like to share? Maybe patient experiences regarding the vaccine, or specifically COVID-19, that you'd like to share?
I personally would like to reiterate the importance of the vaccine. I have a family member who got a kidney transplant. And as we know, as most of us know, when you get a kidney transplant, you're on anti-rejection medications that kill the body's immune system. He literally went to the hospital for something totally unrelated to COVID and had no symptoms for COVID because he got the vaccine. That was the only thing. The doctors told him that was your saving grace. Like, you have something that's fighting the vaccine for you. And if that doesn't make someone a believer, I'm like, he had no immune system and they had no idea he had COVID. They just found out because it's the random test that, not a random test, but they test everyone when they come into the hospital. And he was in there for something totally unrelated. So that to me was a big factor, and it really showed me. And I already had my vaccine, but it's something that I tell other patients, like, it can definitely protect you. If it can protect someone who's on anti-rejection medications, that should be proof enough.
And I also have some personal stories. For me personally, the vaccine, everyone was eligible for the vaccine, or I became eligible for the vaccine when I first found out I was pregnant with my 4-month-old. And at that time, the College of Obstetrics had not, given the green light or said, like, we totally agree that pregnant women should get the vaccine. But for me at that time, benefits outweighed the risk. And I looked at it like, what are my chances of ending up on a ventilator, being pregnant versus a vaccine that, I take, vaccines for everything else. So, not getting this vaccine, weighing my benefits versus the risk. And so even though it had not been all clear, decided that I would rather take my chances on getting the vaccine and staying out of the hospital and delivering a healthy baby. So when I talk to other patients who are reluctant, I just always say, like, you need to evaluate the benefit worth, against the risk. And the side effects from the vaccine and the number of people who have had side effects are so minimal, but your chances of ending up, especially with all of our patients who are diabetics, have asthma, COPD, like, what are your chances of ending up on a ventilator? And to lead into that, I tell my family this as well. And even though we are healthcare professionals, we can't force our families to do what we think is best or what we know is best. So I do have a cousin who has a lot of comorbidities, and she got the Johnson & Johnson. So she got her first dose. And then she started going down the Facebook rabbit hole and decided that she did not want to get the booster. And I pleaded with her to get the booster because me and my entire family had COVID over Christmas, but it was like a cold. Like, we really just had the sniffles, maybe a fever for a day, but it was, done. And I was just pleading with her, please go ahead and get the booster. And she wouldn't do it. And so, needless to say, a week later, she was hospitalized. And so she spent 2 weeks in the hospital with COVID, ended up having to get monoclonal antibodies, and she got out the hospital. But the thing is, without that booster, she has gone back twice for pneumonia, for COVID pneumonia, and now has fluid around her heart. And so I think we also have to really, really push the booster, because the immunity for people who got the vaccine in the beginning is waning so much that, you're still potentially going to end up on a ventilator. You're still going to need monoclonal antibodies, and you still most likely will have residual health complications.
Thank you, Dr. Moore and Dr. Kennedy, for sharing your personal stories. Most recently, I have a cousin who is 25 years old, fairly healthy. He did not get the vaccine at all. He felt like he was invincible, of course. And he did end up contracting the COVID-19 virus, and he ended up being on a ventilator. And they had to keep him for like a week. So he's still kind of trying to come back with his breathing, as it was before, before he had COVID-19. So now he is a believer and he wants to get his COVID-19 vaccine, but he still has some way to go to get back to his normal self pre-COVID. So though definitely touches home. If anyone has any questions they would like to ask Dr. Moore and Dr. Kennedy, you definitely can put it in the chat box via the Zoom chat or Facebook Live. Just want to remind you of that. There goes Dr. Kennedy there. Okay. So how do you feel that we can increase community vaccine rates? We're trying to educate our community as we're doing now. We're telling stories, but what do you believe are some other ways or some other things that we can do to get the community vaccine rates up?
For me, I think for us, I think it's combating the barriers to the vaccine. We are, we are located in Bel Air, but most of our patients come from the inner city. And so it's a medical building. So most of the patients we see, they're in the building to see a physician. And so when they're in the building, they're asking to be vaccinated at that time. So I think a lot of people in communities of color do have transportation issues. That is one of the barriers. And so I think making it more accessible, where they are. So, if most doctors' offices would carry, the vaccine, because a lot of doctors' offices don't. they're telling their patients to go to the pharmacy, or if there is like a nurse practitioner run clinic or things like that, or even other independent pharmacies. If we could all carry the vaccine and become providers, I think that would greatly help, because most of our patients, they have to get the vaccine, kill two birds with one stone. So they don't have another ride to go to CVS or Walgreens, or they can't get to an alternate vaccine site. So if we can just broaden that access, I think that definitely would help.
Dr. Moore, I would like to interject on that barrier of transportation and just having the availability or the accessibility of vaccines at the clinic. So at the clinic that I am at, I provide vaccines. However, I have many colleagues that will not provide the vaccine. So the question then becomes, well, why are the healthcare providers who are providing services to the patients in the community not providing the vaccines? And so here we are kind of face to face again with barriers, because there is a lot of steps, number one, to receive the vaccines. And if you guys are actually providing vaccines at your pharmacy, I'm sure you're still having to follow the same steps that a healthcare provider would be. And that would be the documentation, the storage, the documentation that you have to do within 24 hours. Since the beginning or the inception of the vaccines, they have streamlined it, because initially you had 3 different portals that you had to report vaccines. So I just wanted to interject on that, because I know that we may have community members listening, and if they're wondering why their providers may not have initially stored the vaccines, it could have been a barrier to them. Because when you think about 3 different portals of information that you have to enter, that is more staff. And it's not like you're getting subsidized to have more staff for the vaccines. So that in turn is one additional barriers that most of the healthcare providers had, was the cumbersome steps that we had to take in, number one, obtaining them, and then number 2, the storage and the documentation.
No, I definitely agree. I mean, we spent hundreds of dollars on dry ice in the beginning before they changed the storage, and and it kind of got to a point of like, okay, like even the reimbursement, we are exceeding, it's not adding up. So I mean, we definitely know, and that is a barrier, and so I definitely agree. But now that things are streamlined, storage requirements are getting better, where you can store Pfizer in the fridge, and things are definitely gotten a little easier. So I mean, I definitely, with the patients that we do service, that's just one of the things we find, because like most of our patients need MetroLift. So it's like once they leave that building, they have, there's no way to get anywhere else. So.
That's true. That is so true. The other thing I was going to say about that so to me, this is why it's so important that we have the platform that we have right now. Because you said one key factor, I didn't really want to mention that, but the bottom line is MONEY. Your pharmacy cannot assist anyone if there's no revenue coming in to help pay the lights, the internet, the air, and the heat. And not only is it for the pharmacy, it's for all of the clinics. So I'm saying that to say, I just wanted to pinpoint, because I'm so happy you said that. Everyone needs to know that most or all individuals and most providers who are, whether they're pharmacists or healthcare providers, if they're doing COVID-19 vaccines, this is something true and near and dear to their heart that they want to help to provide to the community in their area, because it's not about any reimbursement or any pay. I need anybody to know that it's about what's in your heart, and that you are a true community server. So thank you so much for pointing that out, Dr. Moore.
Thank you. So what do we discussed mistrust, we discussed risk versus the benefit. how do you, and definitely transportation as being one of those barriers to service for vaccines, but how do you think we can increase their confidence level in the vaccine, and moving forward to receiving at least that first, completing that first series, that first and second dose?
I wish we could get rid of all of the bad press.
Mhm.
I wish we could do something about social media. I mean, I think we right now, it's crazy, you know, people don't have a lot of access as far as transportation is concerned, but you still can see so much information. And I think, you know, of course, we as healthcare workers, a lot of us are the first line of defense, you know, to go against the media, what's all of that misinformation that's out there. To us, it's common sense, right? It's like, you don't want to die, take the vaccine. But there are a lot of things, and that propaganda is so, it's so detailed. It's so, and then you have healthcare professionals that are backing that propaganda. So I think it's just so important that we as healthcare professionals, that we never stop doing activities like these. We never stop answering questions when our patients have them, and doing it more from, you know, answering from an empathetic point of view, and not from the point of view that, oh, I know best and you know nothing. I think a lot of times when we take that take, you automatically create a barrier, because no one is trying to listen to what you're saying, because they feel you're talking at them and not to them. And I just really feel like the more we talk about it, and the more the pharmacists, your nurse practitioners, your physicians are talking about it, we can take the narrative away from the government and from all of these anti-vaxxers. But it really is word of mouth. It really is education, because you can't you can't ban media. I mean, we're in America. It's free speech, right? So they can say and do whatever they like. So it's really important that we as healthcare professionals just continue to not only educate them, but educate ourselves, because we set an example. And you can't go pushing a vaccine to someone and you won't even take the vaccine. You know, and that's something that you have to be honest, because when I started off, I was like, okay, I need to see more research. I want to see X, Y, and Z, right? Because I didn't know about it. You don't know about everything. And so then once I start reading about it and I'm looking at it myself, when I'm speaking with someone, I have a candid conversation. I get you. I know where you're coming from. And I still made the decision because, like Dr. Moore pointed out before, the benefits outweigh the risk. You know, I want to make sure that I'm vaccinated so I can protect other people around me. And then also, America is not in the business of killing everybody. So many people have gotten the vaccine. So look at those numbers, look at that data. We always take the stance of, oh, well, one person had an issue and they could have had an anaphylactic reaction for whatever reason. But I'm like, okay, all of the fast food we put in our bodies, all the things we eat that we don't know what's going in there, and it's not healthy for us. And then you have people that are tirelessly working to help save lives and protect other people. And you have ER doctors, nurses, and I'm sure you've lost patients that you know died from COVID, and you know how important the vaccine is. So it's just really important to really, you know, give all of that information and relay all of that information to the patients. I mean, that's how we battle misinformation, by putting out more good information.
Yes, thank you for that. And that's why we have these conversations, also to get the word out, share personal experiences as well. As far as transportation, one of the sites that we work with in the Houston and surrounding area, they do offer transportation to some of those patients, but they have to have access to the information first, right?
Right.
If they don't get that information access, they won't know, but they are trying to get transportation for those persons to take their shots as well. So I have a question from Miss Elda. She says she has friends who have gotten 2 routine doses of Moderna or Pfizer, but are hesitant to get the booster because they feel they don't need it. Have either of you experienced that with your patients, and how do you think we can combat it?
I mean, it's another matter of just giving the facts and sharing, stories. And so, when I have patients that say the same thing, I quote the CDC, and it's the immunity wanes, it goes down, it has been proven, and you need that third dose. And I also, to put it in more layman's terms for them, I tell them, let's look at the flu shot. Don't you get your flu shot every year? And it's because the flu vaccine is not a vaccine that you get, every 10 years or whatever. You need it every year. And I also compare it to the flu and the fact that just like every year, there's a new strain of the flu. And I say, well, new strains of COVID are being discovered. So, I try to put it into those terms and compare it to something that they are familiar with and say, so this is why you need another shot. And so for me, I feel like most patients, when you put it that way or compare it to the flu shot, it kind of, that light bulb kind of goes off and they're like, oh yeah, I do get a flu shot every year. So it's not so bad if I get another COVID shot in 6 months. So I think that's how we've kind of gotten some people on board with the booster.
All right. Anyone want to add to that? So what I've noticed is I went to an event recently. Things are opening back up. They're having more events, and when I went there to sign in, they asked me where were my COVID credentials, and that was my first time ever hearing COVID credentials. So in order for me to get into that event, which was a March of Dimes event, I had to either have my card or some way to show them that I was vaccinated, or I would not be able to attend without having full, PPE, which I wear anyway. But that was definitely a requirement. So I don't know if that will change with the summer coming up and people getting out and open to traveling. Hopefully, it does. And so I have a number, Miss Elda listed for the Rise to the Vaccine site. For anyone listening, that's for Harris County. That number is 832-927-8787. And that's the vaccine hotline, so that they can assist you with Rise to Vaccine sites.
Also, Dr. Hayes, for transportation, I'm not sure if anyone who is listening in the community is receiving either Medicaid or Medicare, but Medicaid will provide transportation to all of your health care appointments, including transportation to the pharmacy. And if you're not aware of how to contact a particular transportation company, you can call the 211 number, and then they can give you the information on how you can set up transportation. Then I also, at my clinic, I have individuals with Medicare, and there are some MCOs under the Medicare umbrella that will also provide transportation. So basically what we're trying to say is that there should not be an issue with transportation, because we know for a fact that there are maybe 3 avenues that can assist you with getting transported to get your vaccinations.
Thank you, Dr. Brown. Are there any questions from the audience? Any questions? You can raise your hand, or we can list them in the chat box. Or anything to add?
I did find another number. I was trying to find it. I could not find it. So the Houston Health Department, we have a transportation service, but it's only for the elderly and disabled. But I'll put that in the chat as well. So
Okay, thank you so much, Ms. Elda.
There are some questions on Facebook Live, Dr. Hayes.
Okay, let's see. All right, I have them pulled up here. So one of the questions is the Omicron variant beginning to decrease because I'm noticing to see less COVID patients as an ER nurse? Also, in your opinion, will the COVID vaccine become like the flu shot, recommended on a yearly basis? And this is from Mr. Keenan Jackson.
So, from the latest info that I've heard from the city of Houston, numbers and hospitalizations, cases and hospitalizations are going down. I know there is a subvariant of Omicron that has been seen in Europe. Usually we're like 2-3 weeks behind. So, I mean, I'm praying that, I heard about that a few weeks ago. So I'm praying that, maybe we're in the clear with another surge. But as of right now, numbers are going down. And then as far as it becoming a yearly vaccine, I mean, that really has yet to be seen. There are some fourth doses being recommended now for immunocompromised patients. I honestly don't have all the details on me. I don't know if Dr. Kennedy remembers, but there are some fourth doses being recommended now for immunocompromised patients. So, I mean, I really just think that, the schedule is still being figured out. And, and I personally think it might take another, year or so before the schedule is truly figured out for the vaccine. But all I know is when it's recommended, I'm getting I'm getting another shot. I mean, I don't know if it's going to be every 6 months, every year. But it's definitely endemic now. COVID is not going away. And it's just definitely something that we're going to have to, stay up to date on. And when the doses are due, just really push it and drive it home to our patients.
Yes, ma'am. I agree. So we don't have any more questions in the chat. There is the transportation information in the chat for those who are online as well. I just want to thank Dr. Moore and Dr. Kennedy for sitting down having a chat with us today. Dr. Brown, did you have anything else that you wanted to add, or anyone of the board?
Yes, ma'am. I just wanted to make a comment to the question of the ER professional. So I would like to think that what we are doing by promoting COVID-19 vaccines would be the reason why there are less people in the ER at this point who are suffering with COVID, because we are educating the community and others by being advocates the importance of the COVID-19 vaccine. So definitely this would be fruits of our labor. This is what we want to see. And of course, it's evident, Elder may have the specifics now, but I know that it's evident because recently, about a week and a half ago, our threat level went down. You know how it has it in red? That went down. And then I think the last time that I reviewed the positivity rate, it may have been down to 4%, which is very, very low for us. So that's a good thing. And that lets us know that what we are doing with education is working. But not only that, the COVID-19 vaccine is doing its job, because that's exactly what it's designed to do. We are not telling anybody, making any false promises that if you received a COVID-19 vaccine, you're not going to ever get COVID. That's not what we're saying. What we are saying, and what we would like for you to know, that if you receive your 2-dose primary series, your 3rd dose within 2 to 3 months, if you are immunocompromised, and then your booster by that 5th month, what that does is protect you from being one of those individuals in the ER who would progress to ICU because you're now on a ventilator. So I think that is great and wonderful news for us to hear. What about Dr. Harrison? She's hiding out over there. Dr. Harrison, she's hiding from us. Hi there, glamour girl.
Hey, how's it going?
How's it going?
I'll run back to my computer.
I know. What are your thoughts? Have you seen a decline in, let's just say, the positivity rates within your clinic that you are, when you're testing your patients, has there been a significant decline?
There has been a decline, but the patients are still sick. So that I'm thinking when the good doctor mentioned the subvariant in England, I'm wondering if it's here because the patients are testing negative, but they're still very sick with COVID symptoms. So, but I have seen a decline. I do have a patient who probably came in back in October or no, sometime in the summer. Healthy young man, he's like in early 50s. I offered him, about the COVID vaccine, and he was very against COVID. He was like, absolutely not. I'm not taking a shot. I'm healthy. We take our vitamins every day. And then he was in ICU for 69 days. Now he's on O2. He's learning to walk again. And I asked him when he came in to see me, I was like, well, do you still feel the same way about the COVID vaccine? And he was like, where can I sign up to go get the vaccine? He completely changed his thought. He, his wife, and all 6 of their kids were COVID positive, but he was the sickest. So now he's in a state of recovery. He developed PEs and he was just really, really, in a bad spot. But now he is a believer and advocate, and he's out there campaigning, telling everyone to go and get vaccinated. So I think that forums like this really will help to bring awareness to our patients and community, our family members, that COVID is still here. Still get your vaccine. It has not gone away. This is something that we will live with. So just be prepared. And whenever they say, come and get a shot, sign up.
Yes, my sentiments exactly. When the vaccination is available, like Dr. Moore said, I've done my research like Dr. Moore. I stood back and I watched, and I knew that mRNA was not new. So I'm on board. If they develop it, I'm signing up.
All right. Thank you all for attending this evening. I'm still just trying to look for some questions as we wrap up. Dr. Kennedy, did you have anything you wanted to add?
I just want to say to everyone here, thank you so much for your contribution. Anyone in healthcare will know that this has not been an easy journey. I know in the ER, it's even 10 times, a million times worse. I've had family members that have been in the hospital, and just going to visit them in this day and age versus when I visited people 10 years ago has been a totally different experience. And I know that we get tired. I know that we get frustrated, but I just want to extend a personal thank you to everyone. And I'd like to say, if no one has told you, you are appreciated. And please keep up the fight. We can continue to educate. We can continue to just be good examples. And I believe that we will get past this. COVID may not ever disappear, but it is my prayer and my belief that we won't be in such a devastating state as we've been over these past few years.
All right. So thank you all for attending our community conversation tonight. We'll be posting when we'll have our next community conversations and our community events. So we actually have an event at A&K Bake Shop on March the 19th from 11 to 2. So if you all are interested in coming out, getting the education, as well as those who would like to volunteer, please visit our website at nbnpa.empnetwork.com. All right, have a good evening.
And Dr. Hayes,
Yes,
can
we'll
we
stay.
Okay.